But we're available, both of us, and we will send you news if you have actually new things to say. It was available by phone on Monday. We will start back up with all of the information we think somebody needs to do. So, Mayor Engen and Commissioner Slotnick.
Thank you, Jenny, and thank you all for being here today. Thanks for the folks who are here for being here today. While we do have an agenda and folks are going to have some brief remarks, this was largely an opportunity to be available to you en masse for questions that you may have. We're happy to try to get out as much information as we can. And we've all been asked to offer a highlight or two. We have been doing our best to over-communicate as we move through this process. The folks you see here and the folks who are with us virtually are in contact every day and cooperating and collaborating in solving problems. And it turns out in a pandemic there are lots of problems to be solved, some of which have been anticipated and some which just surprise you. And I can tell you that to a person we have problem solvers at all levels of our organizations, and those problems are getting addressed with skill and speed and creativity. On behalf of the City of Missoula, I just wanted to talk quickly about infrastructure and let you all know that the infrastructure that allows this city to exist and for folks to live, play, work, and do business is in fine shape. Our water supply is safe, clean, and we have backup systems that will allow us to operate in the event that we don't have power, which I think is extraordinarily unlikely, for weeks. So we're in really good shape. Most of our systems are redundant, and particularly our utility systems are redundant. So you can expect the services that you receive from the city to continue. There are going to be some small changes. On Monday, we will limit public access to City Hall to protect both the residents we serve and employees. That does not mean there won't be access to City Hall, but it will be limited, and we'll try to provide ways for you to do business either online through the U.S. Post Office or using the good old-fashioned telephone technology, which apparently still exists. So in terms of service delivery, there will be some changes, but those will be minor. All of our other systems, the ones that you count on day in and day out, police and fire in particular, will continue to roll along. And with that, I'm happy to turn it over to Commissioner Josh Slotnick.
Thanks, Mr. Mayor. Thank you all to the media who are here. You are essential in this time of crisis. As Mayor said the other day, when you're gathering information, you should check your sources. We're really fortunate to have such good sources, and they're right here with us in the room today. So thanks to them. Also, thank you to anyone who's listening on this or watching on this. Thank you for doing your part in terms of social distancing, working from home, generally changing your behavior. I want to acknowledge this is really difficult to turn life all around. It's super hard, and people are responding really well and doing their part. Thanks for that. Before I dive into my highlights, the other thing I wanted to say is you'll see really quickly and hear really quickly when you get to meet these folks around me, the level of talent and expertise we have is super high. We're in really good hands, and we're going to get through all this. My quick message in terms of the county. We are absolutely going to continue delivering services, everything from building permits to car titles. You're just now going to be doing it online or over the phone, but it's all going to happen. And if you're interested in a department-by-department rundown, you can check our blog, MissoulaCountyBlog.com, and it's all there on how you can do it. And we are going to keep business moving. It's just going to move a little bit differently. In terms of keeping our businesses going, if you're into local government, you would know we do 3 administrative meetings a week at Missoula County with our Board of County Commissioners. These are public meetings, and then we do 1 large public meeting at the Sophie Moise Room. We're doing all of this virtually now, and you can go to the Commissioners page at our website, and you can find out how you can call in. So these are still going to be public meetings. We have the capacity to handle 250 people calling in, which means we'll be almost as popular as a typical city council meeting, right? So where business is going to go on and public access will go on, it's just going to be done a little bit differently. We have a couple of elections coming up, one in May and one in June. The May election is a school election. It's all mail-in ballot, but June isn't. Well, we're going to do something a little bit differently this year. We are sending out a postcard to everyone who voted in the last election in person at the polls, and we're going to encourage you to vote mail-in this time. Our encouragement goes so far that we are actually going to pay the postage on that absentee ballot, so we really want you to do that. And doing this is not just for your own safety, it's for the safety of our election judges. Most of our election judges are over 65. And these are folks who are going to go put themselves on the front line in very public places to make sure democracy can work. So do your part and lessen the load on those folks and take advantage of our paid postage mail-in ballot and do it that way. Finally, I wanted to mention something about the Red Cross. The Red Cross in the recent past has had to cancel 26 blood drives across the state. They had to do this because they couldn't have all those people in the same space at the same time, which means we have a little bit of a shortage of blood, not due to people bleeding, but due to us not being able to collect blood in the way that we have been. So the way to deal with this is for you all out there to give blood, but get a hold of the Red Cross and make an appointment and give blood. Last thing I'm going to ask you to do is give some money to Missoula's United Way, who has created a fund to deal with our service workers who are out of work and rental assistance. Think of the money you would be spending going out to coffee, beer, and pastry, and give it to them. All right, now you're going to hear from some actual experts.
Thank you, Josh. We should have Corey Aldridge on the phone.
Yes, I'm here.
All right, Corey.
All right. So Mapline continues to operate service. We've had questions as to why are we still running. The simple answer is we are an essential service that benefits the community. There are many people that depend on us as being a reliable way of getting to work, whether it be healthcare workers, medical professionals, grocery store employees, and so many more that have to get to work each day. There are many people in our community that Mountain Line is their sole means of transportation. Therefore, Mountain Line will continue to operate service for as long as it is safe to do so. We're taking precautions, trying to keep our buses clean. We're cleaning them multiple times a day, paying attention to the high touch areas, especially we're trying to protect our operators who are really out there exposed to everything that the public brings in. So we've created a buffering zone around the operator area, 6-foot buffer, so that they can have a better chance of not contracting the coronavirus. We are working on, we have a contingency plan in place that will, if we enact it, will reduce frequency, but it will allow us to maintain service in all of our existing areas. So, for example, if someone is catching a bus every 30 minutes, they will still have access to the bus in their area, but they'll have to wait 60 minutes. We're going to provide the highest level of service for as long as we can. We know the conditions are changing almost hourly. For that, we are going to be closing our transfer center lobby effective tomorrow to the public. Bus island and buses will still come into the transfer center, but the lobby will be closed. We have additional planning that's being done so we can respond to changing conditions. We'll continue to work closely with the city and county on coordinated response to the COVID-19 outbreak. And we'll continue to update our practices and recommendations as made by local and federal health agencies. We are updating our website and our social media constantly to keep the public informed of what we're doing. That's it.
Thanks very much, Corey. Dean French from Community Medical Center.
Hi, thank you. First of all, I'd just like to thank our healthcare workers in the community. They are working hard to ensure that our community is prepared to take care of all patients. We're asking them to do things that they haven't done before. We're asking them to retrain on the spot. As the situation changes, it becomes more fluid. We're repositioning our healthcare workforce so that we can be best prepared to take care of what's to come. And hopefully it will not come, but we want to be there. I'd like to thank our community leadership for really encouraging social distancing, shutting down bars and restaurants. Keeping those things in place is the best way I know to make sure that the healthcare workforce is going to be in the hospital where we need them, when we need them. So thank you to our leadership in this community for that. I'm also grateful in general for the Missoula and state of Montana leadership that we're seeing. Our city county health department has been leading this event from the onset. It has to be fatiguing. I ask that we give them grace and space to get their jobs done. They've been remarkable throughout this, and the end is not in sight. So we need to be mindful about the burden that our city county health department is under in managing this event. I'd also like to thank our healthcare partners, Providence St. Patrick, Partnership Health Center, Western Montana Clinic, who have been great leaders and collaborators throughout this pandemic and planning for it. We've had interesting leadership pop up in unexpected places. The Missoula Economic Partnership has been facilitating conversations between our laboratory leaders and our biotechnology firms in town to try to see if there's ways that we can improve, extend, and expand testing for COVID-19 in our communities. While those plans aren't firm, the very effort that's going on is what makes Missoula a remarkable place to live and to work. In terms of preparedness, Community Medical Center has set up a separate COVID-19 unit with all airborne isolation rooms. We are in the process of planning and expanding so we have a secondary unit in case there is a larger surge. We've implemented our hospital command structure for 24/7 management of the crisis, and we're continually educating our staff on how they can minimize the risk of exposure and take care of patients. Specifically, we limited our entry points to our facility to just the front entrance for non-employees, for the general public. We've completely implemented a no visitor policy to the facility, and we limited our back entrance for our staff, volunteers, and medical staff. All of our staff are being screened for fever and symptoms prior to being allowed into the workplace. All of our patients are being screened prior to appointments in our community physicians group, 24 to 48 hours in advance. If they have symptoms, they are being redirected to one of our group screening areas. Where possible, we are utilizing telemedicine to perform our routine doctor's visits for our community physician group, whether that's pulmonology, rheumatology, endocrinology, family medicine. We're trying to direct as much of that to the telemedicine platform as possible. We are directing all of our patients with symptoms to first call or visit one of our local screening centers or call our nurse on call line, which is 327-4770. For guidance if we're not sure what to do.
Dean, can I excuse you? I don't think your microphone's on for us. There it is.
That was intentional.
There you go. Thank you.
We're asking you to call our nurse on call line at 327-4770 for guidance if you're unsure where to go. We're directing our patients with symptoms to call first or visit a focused screening center so we can centralize our screening processes and testing as well as preserve our protective equipment. Our adult screening center on North Reserve is seeing very high volumes. It is important that part of the screening process is to determine who actually needs a COVID test immediately and who could be deferred and be asked to self-isolate at home. Testing resources are still limited, and we are following the clinical guidelines that we have at this time to determine who is appropriate for testing. We have opened an additional screening center at our Front Street location, downtown First Care, and that is for children and their parents. We're asking people not to go to the emergency room for screening unless they're having severe respiratory distress. All of our staff have appropriate personal protective equipment in our screening centers and our emergency room to prevent exposure to our workforce. We have suspended all elective surgeries throughout our platform in order to preserve and conserve on our personal protective equipment. And we are looking for donations of any type of medical grade personal protective equipment. If someone has that, we ask them to drop it at our front entrance. It has to be in an unopened box. That's all I have.
See if I can turn that mic on. Good afternoon. Joyce Dombrowski, I'm the Chief Executive for Providence, Montana. Thank you for the opportunity today. I'd like to just start and echo some of the comments already made. It's a privilege to serve in Missoula, and really it's a privilege to serve with individuals who are so focused on working together and creating what we think to be the best possible plan and surge for this county and this city. I want to thank every single caregiver that's at work today. One of our infectious disease specialists accompanied me today. Many physicians and nurses are on the front line right now taking care of patients. I also want to take this opportunity to remind you, we've been taking care of very sick patients in this community for almost 150 years, and we will continue to do that. And even though this COVID-19 pandemic has really challenged us and had us look at innovative and creative ways, there are still individuals who are not part of that equation that we take care of very well every single day. And we're responsible for that, certainly, as well as working in the community. We're so concerned with the safety of our caregivers and our patients. It is our number one priority. And our goal is to make sure that we're appropriately conserving personal protective equipment. And you heard Dr. French mention that. It really has been what we have been focused on for the last week, if not 2 weeks, the conservation of personal protective equipment. That has led us to be consistent in terms of eliminating elective surgeries, elective tests, really challenging ourselves to put ourselves in the best position for what we know to be a surge that will be coming at a point that we honestly can't identify. And in addition, we're continuing to look for, again, donations, but really what's the creativity and innovation of this community to help us think about healthcare differently, to help us be better leaders in healthcare, and to really, I say, embrace and be prepared. It is so important for us at Providence, and I know for all of us as healthcare leaders, for our community to understand that we are prepared. We're preparing every single day with the nuances of each new piece of information we learn. We want you to have the confidence in us, and we will be here for you. That's all I have.
Thank you, Joyce. Dr. Josh Christensen, also from Providence.
So I'm Josh Christensen. I'm one of the infectious disease docs at St. Pat's. We got 4 of us, so we're lucky to have a pretty deep bench. I'm from Peaburg, so I'm local. I've got family all around here. So this isn't. So this is something where I'm committed, regardless of how it all plays out. I'm here in it. I do want to make it clear that this is not if this is coming. It is coming. We will have a lot of sick patients at some point. The goal of this social distancing, which I think is essential, is to slow the rate that they come in so it's manageable and we can provide adequate medical care for them. So that we can do that, that's why I've really been advocating with a lot of the healthcare people, including the health department, for cutting back on anything elective, preserving our resources for when we really need them. There's a group of infectious disease docs throughout the state loosely called the Montana ID Network. We've been meeting twice a year for years for an eventuality sort of like this, and we've been in touch almost constantly now. And also roped in with that is the health department, the state health department. This pandemic is something that to some extent we've been preparing for years. When H1N1 came up over a decade ago, and then with Ebola, we've been basically setting up and renewing protocols for that. This, though, is different in that this is going to be on a much grander scale than anything we've anticipated previously. So we do have a lot of plans in place. St. Pat's has a very robust incident command that's been up and running for quite some time. We're working closely with the local and state health departments. We have the luxury of being, as part of Providence, being affiliated with the hospitals in Seattle, so we have been learning a lot from them. There are multiple conference calls. There are trying to think of the right term for it, but basically it's like a Skype conference call. I'm not really up on that sort of technology that much in any case. So we have a lot of communication with them. I've got all sorts of protocols that they've emailed us. We've started putting into place ways we can increase our testing. We've been in touch with the health department, biotechnology companies in Missoula, the university. And the biotech companies in the university, to some extent, reached out to us, and I really found that helpful, and it's also improved my morale, I'll put it that way. People are taking this seriously, and they're paying attention, and we're working together on this. Les Whitney, who's ID over community, I talk to him almost every day. If I don't talk to him, I text him. We've been in close touch over this. We're looking into prophylactic treatments, so if someone is exposed, there may be medications you can give them to reduce their risk. This is all clinical trials. These are studies. There's nothing guaranteed to work, but we're looking into it. Clinical trials for medications that might help someone who's critically ill or even moderately ill from the disease. There's a lot of new developments, and we're staying on top of it. The 3 ID colleagues and me have, to some extent, divided up the workload, and we're really aggressively trying to stay on top of this. This is going to be, I think, I'll be honest, a life-changing event for all of us. I think ultimately we're going to, as a state and as a nation, be okay, but it's going to be a rough, potentially prolonged period that we're dealing with this. I honestly am not losing sleep over it. I think we'll ultimately come through it, but we've got to keep prepared, and we've got to be really aware of the importance of social distancing. I think the governor's call to shut down the bars and so forth was the right move. I really do, and I think that was a bold move, but it was the right thing to do. We really need to encourage social distancing. It does us no good to throw everyone out of the bars if they're sitting around the parks drinking out of growlers. We got to keep people moved apart to reduce the risk of spread. This illness, this disease is very hard on the elderly and people that are chronically ill. So part of this is to protect them. But young people can get sick too. Generally they get through it okay, but there's no guarantees. So this is something we just really need to be aware of. And the way we protect the population as a whole is we minimize or reduce the rate of transmission of this virus as much as we can. So social distancing is essential. If we're able to slow it down, we're not going to be the next Italy. We're not going to have the 8% mortality that they're having. Now, that number is a little hard to pin down because I think they're at a point they're only testing the really sick people, so the mortality rate's probably nowhere near that high, a fraction of that probably, maybe 1% or less. But in the United States right now, I think we're around maybe 1.3% based on our available testing. But these are hard projections to make because our testing is so limited. We really don't have a full idea of what's happening, so I think we really have to prepare for the worst and hope for the best. I think with the partnering we're doing and being a somewhat more rural state, ultimately we'll come through this, but it ain't going to be easy, nor will it be over quickly.
Thank you. Do we have President Bodnar with us?
Yeah, from here.
Hi.
Well, thanks, everybody. Yeah, all we did is the evolving situation, and we've, of course, remained in close contact with all of our community partners, and we just continue to appreciate the collaboration, the teamwork, and everyone's been part of that. Every decision we make at the University of Montana, we remain steady in our commitment to the health and safety of our students, staff, and faculty, and of course, to broader Missoula community. Just a couple of brief updates from the university. And I really saw that last week we announced we would move to remote course delivery starting on March 23rd after spring break. We announced earlier this week that we will actually continue with remote delivery through the rest of spring semester. Our professors are hard at work right now preparing for that transition and contacting students with information on each of their courses. Second, earlier this week, we also strongly recommended to our students that if they have another housing option, they do not return to resident college after spring break. As Dr. Christian pointed out, social distancing and the importance of that is, of course, difficult to do that in a crowded residence hall. So we strongly recommended students in residence halls to not return. We're, of course, going to work with any and all students for whom this causes a hardship and have a timely process for move out, so families are not overburdened. But we do understand, and it's important to note, that for some of our students, who can't visit their home, and that's okay. We're going to continue to work with local health officials to ensure that we continue to provide the best accommodation possible for those students in our residence halls. But it may be that some students have to change residences as we consolidate services and enact appropriate social distancing measures. But students that need it will have a home with us through the end of the semester. We've also encouraged students who live off campus to encourage to continue their studies in a location where social distancing is most feasible. For some, that may be near Missoula, because that may be back in their hometown. And we encourage our students to consult with loved ones to determine what's best for them. But as Corey mentioned with regard to mountain lying, the university also has a duty to provide essential services for our students. So we will continue to provide student-focused services on campus over the coming weeks and months on a modified and much more limited basis. As you've seen, for the county guidance, our campus rec facility remains closed. Our libraries are closed to patron visits. So elected services from the Missoula Library available on a appointment-only basis. Dining services are significantly consolidated, limited to grab-and-go models. Our current health center, of course, remains operational. But we, at the same time, are shifting many of our resources and services, like advising, like counseling, available online, and in some cases over the phone to serve our students. At the same time, we're working to protect the health and safety of our community. We're also continuing to work tirelessly to enable our students to make continued progress in their academic programs. This is, you can imagine, a challenge, but I've been really proud of the way our team has stepped up and to meet student needs here. And in some cases, specifically some of our training programs on our health professions in Missoula College, we're actually working at the request of community leaders to accelerate program completion for some of those health service workers that we've been anticipated and currently existing needs in our community. A key task for all of us is continue to keep our students engaged. Sure, our students are really pleased. Our UN family is scattered around the state, around the world, but we remain united by that fierce spirit within the heart of every Grizzly. And over the coming days, we're going to be working creatively to help our students stay connected to our community, to each other. It's a very important thing that we watch out for the health and safety, but also addressing some of the mental health challenges that come about and dealing with situations and change of this magnitude. So we're working really hard on that front. And just to share finally, we have our UN website. Those of you who have specific questions about the University of Montana, we have a COVID-specific website set up. It's www.unc.edu/coronavirus, and also an information line for university-specific questions at 406-243-info. Again, 406-243-info. Thanks, everybody.
Thank you. I'd like to introduce now Cindy Farr from the Missoula City County Health Department. She is the incident commander for this epidemic in Missoula. I want to remind all of you to please try to use your mic and to turn it off when you're done.
Hi, thanks, Ginny. As Ginny introduced me, my name is Cindy Farr. I'm the incident commander for the Missoula City County Health Department COVID-19 response. First off, I just want to say thank you to everyone in this room for being here today and for all of the hard work that you all have done over the last several weeks trying to prepare for this and working very closely with us to make sure that we're all on the same page and helping each other as best that we can. I also want to say thank you to our Missoula community. I know that everything that has happened in the last couple of weeks has been very much a disruption to your normal daily life, and I just appreciate very much that people are actually doing what we're asking them to do and really honoring those social distancing practices and making sure that we're doing what we can to protect the vulnerable people in our population and slow the spread of this disease in order to protect our healthcare resources. We currently are at 4 cases of COVID-19 in Missoula County. All 4 cases are related to travel outside of our Missoula area. So what that means for people who are watching at home is that we do not have community spread at this point that we know of. It is still extremely important that you practice the social distancing, wash your hands, cover your cough, all those kinds of things that we're going to continue to say to you. But what we're doing is working because we're not seeing a large jump in numbers quite yet. That gives us the opportunity in public health to learn from what is working in other parts of the country and to learn more about the epidemiology of this virus as it is taking out other parts of the country before it gets here to our communities. So I just appreciate the public support for us and what we're doing at the health department. On that note, we've really expanded everything that we're doing at the health department. I want to say thanks to the overwhelming number of nurses who applied when we put that call out on Sunday. We were able to staff and have backup staff on hand so that not only if our staff were to contract the virus, but as this starts to get bigger and we need to pull in more staffing, we have all the staff that we need right now. We also just want to say that we appreciate our local government and everyone who is reassuring us that, you know, we have infrastructure that's in place that is still going to continue to operate. We definitely need that at the health department, and we are also keeping our essential services open. Our immunization clinic is open. Our WIC clients are getting telemedicine visits so that they can continue to get their supplies for WIC. Our home visiting nurses are still visiting with their families remotely as much as possible. So if you still need those services, they're still available. Everything in environmental health for permitting and inspections and all of that is also still happening while we've got this response going on in the background. I am doing daily briefings every day. I know that my PIO is trying to get those on our Facebook page and the link on our website by around 12:30 every day. So for the most up-to-date information from the health department, that is definitely a good place to get it. It's where we're trying to answer a lot of the questions that we're getting on a routine basis throughout the 24 hours. Whatever we're getting a lot of questions about, I'll address in those daily briefings. And I think that's all I have. Thank you very much for everyone and all of your support, and we're going to get through this together.
Hi, it's good to be here, and it's good to sit in this room with all of you. I think the public may know this, but we work together all the time in this room, and as I look at the hospital representatives, we have healthcare people, we have nurses and doctors in the room running organizations, and we didn't just start working together today, but have worked together weekly. So, and then with our county officials and the mayor, health department, we are already in groups, so to mobilize has been not easy, but certainly cohesive and collaborative. And I would say the same with the federal government, actually. For us as a federally qualified health center, and also the state government has been very involved in what's going on in our communities. And I feel like we are as well supported as any time in my past. So I just really feel honored to be working with all of you and in this community. And as Cindy said, we've had great community response. So thank you all. Partnership Health Center does serve about 15% of the population in Missoula County and also in Mineral County. We've had an incredible response on our staff. Part of, as you heard from the other healthcare entities, our first goal is to protect staff. We've been doing that well, putting people off-site, putting people in remote locations who are at higher risk. And then we also have altered a number of our services. We're still available to all our patients. We offer medical, dental, behavioral health care, and pharmacy services. Those have changed to be far more phone-focused and Skype and Zoom meetings, and they're working quite well. So I think all of us have had to turn on our head to continue to maintain services. We also were able to hire 4 EMTs overnight, which was incredible. We brought on a couple short-term janitors who have been really helpful, so we're wiping down surfaces much more actively than we already were. We screen people at the door, just as with the other entities in the room. Everybody is screened. We have been really interviewing about 25 to 30 folks a day, and of that group, we are swabbing, meaning we have a higher degree of suspicion, 10 to 15 people. So far, all have been negative, as you heard in this room. So we are doing a good job together. It doesn't mean that we won't have cases at some point, but we feel quite excited about the response on the part of all of you. The other population that we're all concerned about is the homeless population in Missoula. It's not huge, about 300 people, but it's a group that's at high risk, and we're working very actively together to make sure we screen folks, that we're available to see people, and that they get housed in locations where they can be tested and recover should that arise. So that's an area that we continue to be really focused on. I think that's all I have. I just want to thank the folks in this room and the people of Missoula and Mineral County. Our Sealy site is doing the same thing. It's the only healthcare in Sealy and responding similarly. So thank you all.
Thank you. Next, we have Bob Watson, who is the superintendent of Missoula County Public Schools.
Thanks everyone. Again, just want to reiterate, appreciate the collaboration that's happened with folks in this room as well as other folks in the community. It's been great to have the opportunity just to talk with everyone on a variety of different issues as they come up, and being able to just communicate openly and problem solve has been really nice. I have just a couple of updates since our last press conference. As you're probably all aware, the governor issued a closure for all schools in the state for a period of 2 weeks. It didn't affect us this week because we were already on closure for spring break, but we will continue to be closed this next week. The governor has not yet extended that, so right now we're closed through March 27th. We're continuing to message throughout this week. We've continued to message our staff and our families about any information that we know and how we're preparing for this event. One thing to note, which I don't think has been mentioned yet today, is yesterday the governor issued an advisory for those that are coming back from spring break, asking those that have traveled internationally to self-quarantine for 14 days. We have messaged that to our parents and our staff that might be returning from international travel after spring break. Essentially, our schools and our administration buildings are closed to the public. We've asked all of our staff that could work from home to work from home. Of course, the buildings are still staffed by our custodians, who are doing an excellent job cleaning the buildings and making sure that they're maintained. But other than that, there's not really anyone in the buildings at this time. We have done a ton of work, though, to prepare for Monday, and I'll just mention a couple of things. So our teaching and learning staff worked hard this last week to ramp up our online learning presence. We've got a website that's going to launch later today, and it'll be ready for parents starting on Monday. It's full of activities, relevant and engaging activities, grade level specific, subject specific, so that parents could have an option to take a look at that and help their kids through some of those lessons and activities. Next week, as our teachers come back, they won't be back in the buildings, but they will be answering emails from home. And then the other thing I just want to mention is our preparation around food service. So we are ready to go with food service on Monday. Our staff worked very hard this week. Last count I heard was 6,000. That's 6 with 3 zeros. 6,000 sandwiches that were prepared this last week to get us up and ready for Monday. This is how we're going to do the food delivery option for our kiddos. We will have 4 school sites where people could stop by and pick up food, but we will also be delivering via school bus. So our transportation company, Beach Transportation, has done an excellent job to help us plan this. So starting Monday between the hours of 11 and 11 a.m. and 12:45, our buses will actually be driving their regular bus routes, and they'll be making stops at the regular bus stops to distribute the food. We found that this would be better to get food to our community because those bus stops are in neighborhoods and closer to homes where kids could walk and pick up the food. I also want to mention that this food is open to anybody. There are no qualifications. There's no income qualifications. There's no age level qualifications. You don't have to have previously qualified for free and reduced lunch. This food is open to any child under the age of 18, including children that are homeschooled or including children from private schools. And the best way for folks to figure out The location closest to them is go to our website or go to Beach Transportation website, plug in their address, and they will get an exact location closest to their house, as well as the pickup time for the lunch. We'll not only be providing the lunch, but also for breakfast the next morning, so they'll actually get 2 meals in one bag, and then we'll come back the next day with another bag at lunchtime. So those are the big updates I have for the school district. Encourage our families to just keep watching our website, keep checking their emails. We'll be updating families on a regular basis.
Thank you. Do we still have Adrian back on the phone?
Yes, we do.
Hi, Adrian. Adrian is the Director of the Missoula County Office of Emergency Management.
Thank you, Jenny. Thank you for the opportunity to talk through some of the activities and planning that we're coordinating within the Missoula Office of Emergency Management. No matter the disaster, I'm always just super proud of this community and how it works together and how quickly our agencies come together to solve very dynamic problems. And amid a global pandemic, this problem solving, forward thinking, and coordination is occurring at a mind-blowing tempo. And I am so honored to be working closely with a lot of really smart and talented folks that are going to help us all get through this. So, early this week, both the city and the county declared emergencies related to COVID-19. That action was really an acknowledgement of the broader community impact associated with this that we've all talked through and all the speakers ahead of me have talked through. But what that did was that enabled us to open up our emergency operations plan and to formally kind of kick our emergency operations center and emergency coordination center into high drive by forming a management team that is working to coordinate all of the response efforts that are going on across the county so that we can assist our healthcare partners and the city county health department to meet their objectives by reducing the complexities that they face and solving some of the problems associated with that. The other main thing that this team enables us to do is to build capacity for resiliency and plan for recovery. And this will end at some point in time. So much like we've done for fires and floods, one of our big key partners in this are our community organizations that are active in disaster. This group meets frequently when we're activated, so just this week we've met 3 times via conference call, and that schedule will continue into the future as the need rises. It may be more frequent. But what this group really does is they get together and they anticipate what unmet needs or gaps may be out in the community, and they collaborate so that they can increase their readiness and their capacity to address those needs collectively as a group, and to serve everyone in our community amid this disaster. Last thing I want to say is that for the last 2 weeks, the public has been able to call 258-INFO, 258-4636, to be able to speak with public health nurse about COVID-19 related questions. Starting Monday at 8 a.m., they will still be able to call 258-INFO to talk to a public health nurse about COVID-related questions, but they will also have the opportunity to talk to staff in the Emergency Coordination Center about resources and how to get connected to resources that they may need. So tomorrow and Sunday, that will just be a recording, but Monday morning, 8 a.m., we will have live staff available to answer those questions. Thank you.
Thank you. We can open it up for questions.
How many people have been tested in Missoula?
We actually don't have that number because it's changing literally by the minute. Sorry.
The school superintendent, I talked to the YMCA this morning, and they are discussing plans to ramp up the opportunity for childcare for frontline emergency workers. They suggest they may be doing that in partnership with the school district. I'm wondering if you could talk a bit about what you guys are doing on your end to prepare for that potential need.
Yeah, thank you for the question. So there is a task force in town, Emergency Child Care Task Force. A couple of names attached to that. Grace Decker, who many of you know, works for the United Way 0 to 5 initiative, but she's heading up that Emergency Child Care Task Force. They're still making some plans and doing some surveys to see what the need is. We have spoken to the Y about the possibility of using one of our facilities for an emergency child care center. It would not be a drop-off center. They would have to register ahead of time with the YMCA. It would be essentially a very small center, so less than 50 students, less than 50 kids broken into groups of less than 10 during the day. We would also be targeting children of essential services, so hospital workers, first responders, any other essential services identified by the city or county. That would be the sort of the target audience. None of those things have been completely worked out yet. I know that there's lots of communication going on with that Emergency Child Care Task Force. We have members of our team on that task force, and assuming we'll be able to make announcements about that in the coming days.
To the hospitals, do you have any patients in I'm not sure the proper term, respiratory isolation at this point in time in Missoula County?
I can answer that. We have patients in respiratory isolation almost every single winter, all the time. So the isolation that we might have for a potentially rule out COVID patient is the same isolation that it is for respiratory. So yes, we do have some of those in, at least at St. Pat's today.
What's your capacity and how close are you to reaching capacity as you currently stand?
That's a great question. Our capacity varies. That's part of the surge planning. We're licensed for 254 beds. We run a census of about 160, 170 on any given day. With the closure of our elective cases, our census really today is right around 100. So we have capacity, and that's part of our surge planning, is to be organized enough and be ready when patients will arrive.
Mr. French, do you have anything to add?
No, my answers are the same. We are licensed for 154 beds. We run an average census of about 90. We're currently at 70.
Special places that are set aside to deal with this?
We have just identified an area of the hospital where we've set aside rooms for respiratory isolation in addition to our normal capacity. That has just expanded our respiratory isolation capabilities by about double what we were prior.
The only addition I would have is that the CDC does recommend to cohort patients in respiratory isolation. That really makes sense from a transmission standpoint and really a preservation of PPE. So we too have a cohorted unit. And then I would leave any other epidemiological type words to Dr. Christensen.
Let me get today's most unpopular question. This is for the mayor. There's a lot of dissatisfaction on social media about the fact that parking is still being charged downtown. Given the challenges that local businesses are facing, the temporarily laid off workers, why is the city still collecting parking fees at this point in time?
Sorry, so turns out that the machine needs to keep running, and so paying those parking meters just supports our parking organization and our ability to build parking and maintain those facilities. We're not ticketing folks for meter violations currently. You're likely getting a whoops ticket, so you probably have a blood pressure spike. Then you take the ticket, look at it, and feel some relief or anger, depending on the day. So that's what the Parking Commission is doing. We're still ticketing for safety violations. If you're parking in front of a fire hydrant, if you can't stay between the lines, we're going to probably ding you for that. But we hear that, and the Parking Commission is happy to try to provide some relief there.
And I thank you for that question. I just paid my parking.
It's the first time.
Question for Cindy and then maybe Dr. Christensen, you could type in this. We and I talked about this the other day. There's a lot of references we're seeing more and more about Spanish flu in 1918. Can you kind of give us a sort of an expert's idea of that comparison between what we're seeing now and historically what we may have seen?
Yeah, so we talked a little bit about does this compare to what we saw for morbidity and mortality with H1N1 back in 2009, 2010. And what I said at that time is that really it's more equally compared to the 1918 influenza pandemic. There are a lot of differences right now because when we look at the 1918 influenza pandemic, we didn't have technology then like we do now. And so we don't really know how that's going to play out in our country. But looking at the numbers that are coming out of other countries that have experienced really large numbers of cases, as far as morbidity and mortality, it's very similar at this point. And I would turn that to Dr. Christensen if you have other things to add.
Countries like Italy that are really in a crisis are having better than. Okay, yeah. Countries like Italy right now, it's really in a crisis, and there's different. John Hopkins has a website that basically keeps a pretty accurate tally from the World Health Organization and other sources, but they're looking at, as of a few hours ago, 4,032 deaths out of 47,021 cases, so that gives you about 8.5% fatality rate. But you look at countries like Denmark with a lot smaller caseload, and their fatality rate's 0.5% or less. The U.S. is right now, I think, 216 deaths out of 16,605 cases. That's, by my math, about a 1.3% fatality rate. I think the Spanish flu was around 1% is what they're guessing, I think, if you look back. What makes this really hard is we do not have yet adequate testing. And when I say that, I don't mean that it's our health department is failing us or not. The state health department, I think, is probably one of the better ones when you look at the turnaround time as far as getting test results back. We can usually, if we go to the state health department, get a test result back in 24 to 48 hours, which is pretty good. The problem is they're limited to the number of tests per day they can run just based on the technology they have at this time. They're doing everything they can to ramp it up. The bottleneck is further down or further upstream in them getting the reagents and the equipment. And that goes for the whole United States, really. So we don't, I think, have a great grasp of what our overall numbers are at this point. I think there are multiple arguments on why Italy's death rate is so high. It has to do with an older population. A quarter of the people there are over 65. There's debate about the robustness of their healthcare system. Some literature says it's actually a really good healthcare system. Some said maybe not. But I think it's a reasonably good healthcare system. A lot of it just has to do with the cases all came at once. So when you have a hospital that is able to take care of, say, in normal times, for example, just picking number 200 beds and in a crisis 300, and you have 500 people that need hospitalization, some of them are going to get inadequate medical care. You just don't have the resources. And that's the whole point behind social distancing. You slow down this rate of infection. You don't overwhelm your hospitals. Your hospitals are able to provide quality medical care to all the patients, and then your death rate drops. I think a mistake a lot of people make are just looking at how many live and how many die. What people fail to realize is when these patients are hospitalized, a lot of them aren't in and out of the hospital in a day or two. They require an enormous amount of healthcare resources. The question about the personal protective equipment, why we're being so careful with it is we don't know for sure when we're going to get more. The strategic stockpile's been opened up, and perhaps we'll get some of that, but we don't know for sure how much we'll get or when. And the amount in the strategic stockpile is not adequate for the whole United States. It simply isn't. And nor was it designed to be that way to supply the whole United States. What it is to do is to give us a cushion until manufacturers can make enough of their own to supply the United States. We don't know when that pipeline is going to be open, so we have to preserve because we may need this. The other thing is we may need to share it with other areas too. At Providence, we're part of this bigger system. If they need resources and we have them, we will share with them. Likewise, if we need it, they share with us. The reason we're so far ahead, I think, as far as looking into actual treatments, which most other places haven't scratched the surface of, is because we're affiliated with Providence and Seattle, and they've been dealing with this longer, so they're able to say, hey, this is what we're doing. They give us these resources, this information.
And I would think, quick follow-up, I would think too, if you're looking back at, say, 1918 or 63 or even H1N1, you're looking in the rear view mirror, whereas this one, we're kind of at the leading edge of the research. I mean, we're in the process of learning to go, right?
Yeah, that's correct. When we look back at past epidemics, that's all in hindsight. In 5 years from now, we'll be able to look, or hopefully even within a year from now, we'll be able to look back in hindsight and say, okay, this was our total infection rate, this was our fatality rate, this was our rate of break it down by age groups or you name it. We'll be able to look at that data, but right now, these are all educated guesses based on the numbers we have available.
Why is the governor's office handling the release of positive coronavirus cases?
Good question. We are releasing the positive cases that we get in Missoula when we get them. That is part of my daily briefing that goes out every single morning. I'm not really sure at what point the governor's office became involved in releasing medical information, as we've never really experienced that before in public health. So I don't really have an answer to your question. We are a good source for our local data. So I would definitely refer you to looking at our website, watching my daily briefings, checking, calling 258-INFO if you have questions, but that we're going to be the best source for our local data for you.
Follow-up to that then would be, if there wasn't data, would you guys do want to release that information?
Yes, and that would probably come out as a combined press release from our office in combination with the State Health Department.
To the two elected officials, how does the timing of this impact the upcoming budget season? How will it impact what you add to the budget, subtract from the budget? I know it's early in the process, but you must be going through your mind at this point in time.
It is to a certain degree, Martin. This is an elephant we're eating a bite at a time. And this week really has been all Corona all the time. We have two huddles. A group of about 20 people are on the phone. That's University of Montana, Missoula County. We have folks from Incident Command. We have Emergency Ops. We have School District and staff. So we're huddling in the morning at 9:30, kind of reviewing yesterday, making a plan for today. And then we huddle again at 4:30 to see what we've gotten done, make another plan for the morning and overnight. And then my staff is having a huddle at 11 o'clock for internal operations, and everything in between is sort of dealing with the attendant issues of a crisis the likes of which we haven't seen. All that said, we're still doing the daily stuff. We close swimming pools. That's a missing revenue stream. There are all sorts of implications to this, some of which are going to be obvious and some that we're not going to see for some time. We are always as conservative as we can be, and I think we'll be extra conservative this year. And, our response here can't be mutually exclusive to doing the nuts and bolts work of local government. So this is about the time that budget season starts to kick in. We've got systems in place where I think the day-to-day management of processes associated with COVID response are going to be tempered, and we can do some of that work in a more concentrated way, but we have yet to see.
Should it do this, or you want to skip?
You might have to repeat that question.
The question was directed, I'm not sure who asked, as far as closing current child care facilities that are open and operating, as well as churches throughout the city county.
The question is about future closures, including churches and other facilities. I think that's probably a Cindy question at this point.
And child care facilities.
At this time, there is no plan in place to close child care facilities or places of worship. We have definitely given some guidance to our places of worship so that we can help them figure out ways that they can maybe give their sermon from a distance using technology, or breaking it up so that they're doing multiple different sessions so that they can still reach their congregation. As far as childcare facilities, there's no plan to close them because we do need our essential personnel that provide essential services to be able to go to work. And at this time, what we're seeing is that this disease does not affect children in the way that it affects adults. I know that we're still waiting for a lot of research to come out about that, but from what we're seeing worldwide, It is affecting children in much lower numbers, and when it is affecting children, it's affecting them, they just get a much more mild form of the illness for the most part.
And I want Commissioner Slotnick to have a chance to answer Martin's question as well.
Thanks, Mayor. I wanted to say that the provision of services that we are all accustomed to, everything that makes our society safe, predictable, reliable, those things are absolutely going to continue. Those services are a foundation for all of economic and cultural life, and there's no way we are going to sacrifice those. Also, we're super sensitive about the huge economic shift that has just taken place. Our budget season is we're about to embark, and we're going really a real radical shift from 2 weeks ago, 3 weeks ago, feeling like, well, we're in a time of relative prosperity. How can we invest in the future? To right now where we're still reeling and trying to figure out, as the mayor said, what are the implications? We don't even know yet. But there's no way we're going to sacrifice on the services that people absolutely depend on and a real high-functioning society depends on.
Why are you releasing by county, not by city? And then, yeah, go ahead.
So the way that public health is structured in the state of Montana is that each public health department, each county has a public health department. And so our jurisdiction for Missoula is a county jurisdiction. So when you hit the county line at Ravalli County, then they become their own, they have their own jurisdiction, and it's like that for every county in Montana, according to state law. So we don't release the specifics of where people have traveled to because we have such a small number of cases in Missoula County right now that in order to protect the privacy of the patients that are involved, we want to release as little information about those people as possible.
Every day, every hospital in the state does an inventory of personal protective equipment, and we download that twice daily into a system that the state has stood up called Juvari. So we are tracking PPE throughout the state, and we're also having almost every other day phone calls with other hospital leaders about our PPE inventory. In addition, the hospital system that I belong to, LifePoint Health, does a LifePoint Health-wide inventory of personal protective equipment across our 88 hospitals, as I'm sure is similar with the Providence St. Joseph system. We have not laid off any employees.
How are shutdowns and closures going to be enforced?
So we've been working with our law enforcement agencies throughout the county to determine the best way for enforcement, and because the orders have come down, up to this point, the orders have come down from the health officer. That gives the law enforcement basically the authority to enforce any health officer orders, and I believe it is the same for orders that come down from the governor.
Law enforcement county or city?
Both.
We've had tremendous cooperation from the businesses that are bearing the brunt of these closures. It's pretty remarkable.
Last question. Is it too soon to start talking about graduation and backup plans or cancellations or at this point in time?
Yeah, I don't.
Maybe for
Yeah.
both of you.
Yeah, I would defer to Seth on obviously on the university stuff. We actually are looking ahead at all spring activities. The Montana High School Association has canceled all spring activities at least until April 13th. They may end up canceling all sports activities for the rest of the season. But we're looking ahead to all those things and trying to decide if we can reschedule, we will. But we haven't looked at graduation yet.
President Bodden, are you on the phone? Do you have any thoughts on that?
Yeah, I'm still here. From the university standpoint, that is something that we're assessing right now. We're working really at the system level, Montana University system level, when it comes to decisions about assessment. We'll be having those decisions. We'll be discussing that issue over the coming days.
Thank you.
I couldn't quite hear your question.
Is takeout and delivery service for food service, hazardous spread infectious disease, or is that right?
Provided the people preparing the food are not sick, I think the risk is pretty low. This virus does have a risk of being spread as a contact, meaning if someone has it and they have it on their hands and they prepare food and you could theoretically grab it, eating it probably isn't a really high rate of transmission. Your stomach acid would probably take care of it, but you could theoretically rub your eyes or nose. So the risk, I think, is pretty small. I mean, I don't plan on stopping eating takeout, I'll put it that way. Particularly if they'll give me a beer while no, I'm just kidding.
I would take that as an endorsement.
Beyond that, as an endorsement, do your part to support the restaurants we have, so go get some takeout.
Anyone else? Thanks very much.
Thanks to all the folks at the table, all of you for coming.